Hello everyone, my name is Dr. Lindsey Carper, your chiropractor with Balance Solutions Healthcare, and I want to talk to you today about scoliosis, as it's been requested with a couple questions in the past, so today I wanted to bring it up. The biggest test that we use to see scoliosis is by the forward bending test. So that's just when the child or adult leans forward in front of us and we look down the straight middle of the spine and we see whether or not there's a curve in the spine. So what scoliosis is while the spine is normally supposed to be straight when I'm looking at you straight on like this, but there tends to be a little bit of a curve in there. That curve is called scoliosis. So you can have the curve in your neck, in the back, mid-back, or in the low back, and you can even have it one small curve up to 3 curves. And that just is going to define the level of scoliosis that you are. So there's 10 different points that I want to talk to you about scoliosis. So number one, while we look at it by that forward bending test, the way that we truly see scoliosis is by x-ray and being able to actually measure the angle that there is the scoliosis. And so that Cobb angle is what it's called. That angle has to be greater than 10 degrees. Now, scoliosis is actually extremely common, and it's anywhere between 1 and 3% of people, making it the most common spinal deformity. Now, I say deformity, but it's not so crazy. But it's the most common that requires orthopedic management. So management being aware of it, looking at it, and keeping a watch on it. Number 2, it's actually noticed as genetic component, and so it does tend to run in families. So when your parents have scoliosis, it is actually more likely that you will, and it's actually more common when the child is born to an older mother. Number 3 is approximately 1/4 of all of the scoliosis out there that we don't know why they're adolescent idiopathic scoliosis, are actually going to progress and get worse. That chance of progression increases when you have a larger curve, as well as it decreases in proportion to skeletal maturity. So the smaller curves are less likely to progress, while the larger curves are more likely, as well as when you have more curves. So when you have the curve in your neck, your mid-back, and your low back, it is more likely to get worse. Number 4, your curve progression is actually more likely if you are a woman than the men. So while scoliosis is found in both men and women, it's more likely to get worse for females, as well as when you have multiple curves, it is more likely to get worse. Number 5, when a scoliosis is noted in a very young child between 6 and 12, it is actually it's a lot worse, and it's a bigger deal, and that's when we actually really do need to keep an extra eye on it, because there is a high chance of it progressing, versus noting when it's slightly older, when you're a teenager, because you're almost at that skeletal maturity, versus when you're young, your body has a long way to still grow. Your 6-year-old is nowhere near as large and as tall as a 20 or 30 plus year old. And then it does tend to need specific direct care and needs to be addressed immediately. Number 6, approximately 1/4 of scoliosis patients have back pain. So just because you have scoliosis doesn't mean it's going to make your back hurt. However, the presence of scoliosis is more than 3 times likely a cause of developing spinal pain and back pain when you're an adult. So watching it and making sure that it is maintained and we can address the different muscles, because when that curve is here, these muscles are tight and it's pulling on these other muscles, and so it can affect that mid-back pain, that low back pain, whatever it is we are working with, but it's more likely to give you back pain. But just because you have scoliosis does not mean you will have back pain. So let's try to get maintained and keep you from having low back pain. Number 7, incorporating chiropractic care with adjustments has definitely been shown to reduce the angles of your scoliosis. So while chiropractic cannot necessarily completely get rid of your scoliosis, it has been shown to improve the angle and decrease that curve. So we can help that scoliosis and we can help make that better. Definitely being able to help with that back pain if you do have it and help you avoid getting it. Number 8, there's actually been studies, a lot of studies that have shown exercise is actually really effective for scoliosis as well, and being able to help strengthen and stretch and balance those muscles in the back and the rest of the body to keep that scoliosis from getting worse and helping it improve. Number 9, brace treatments are actually reserved for 30 to 40 degrees. So if you remember earlier, I said scoliosis is marked when you have a curve of about 10 degrees. So it's a very, very small curve, but it's still noted, yes, this is scoliosis. Now, when it gets to be 30 to 40 degrees, that's when it does need a brace, but that's also only for patients that are still growing. So when you have that preteen, 10, 11, 12-year-old, and they show up with scoliosis, and even your teenagers, they have scoliosis and they have a higher degree, we definitely want to brace them so it does not get worse, because they are still growing and we definitely want them to continue to stay straight and to improve and grow vertically. And number 10, less than 0.3% of all scoliosis cases require surgical correction. So that's only when you are greater than 40 degrees. And so if you consider this is about a 45-degree angle. So if I were to have a curve, instead of being straight here, it's all the way over here. That is where surgery is actually required. And very, very seldom does that occur. And what is sad is there are quite a few people out there that are older and they had surgery because of their scoliosis, and they have a rod down their spine, and so what it does is it then uses that rod to hold and reattach that spine so it stays up and straight. And they might not have actually needed to have it, but somebody, when they were younger, said, you have scoliosis, we're doing surgery to fix it, rather than the research of saying it's going to be okay. So definitely, that's numbers 1 through 10. If you have any questions about scoliosis, please talk to me, or see if you already have a chiropractor. Talk to your chiropractor if you have any questions. We love talking about scoliosis and we love being able to help you out. I love talking about all different types of chiropractic issues and different pains and seeing what I can do and how I can help you. So this is 1 through 10 on scoliosis, that it's okay when they're seen in the younger ages. We want to make sure that they don't progress and they don't get worse. But overall, helping chiropractic helps, exercises help to improve that back, to decrease any back pain, as well as to decrease the actual curve of the scoliosis, and help you and help your children, whoever it is that we're working with, feel better and move better overall, being able to function and continue on throughout their lives. Again, my name is Dr. Lindsey Carper, your chiropractor with Balance Solutions Healthcare, using chiropractic, acupuncture, and sports rehab to help patients feel better and move better. So whether you're finding me right now on Facebook, you can find me Facebook Dr. Lindsey Carper, or you can please subscribe to my YouTube channel. I share lots of videos through there, and I'm always happy to help. If you have any questions, just let me know. Have a wonderful day.